Welcome to the workshop on tackling homelessness, city and state. My name's Tony Hannigan. I'm a board member of SHINE and the executive director of the Center for Urban Community Services, CUCS, which is a nonprofit organization based here in New York City, and we provide a range of services and training and housing, including supportive housing. Also want to say that we're honored to have 4 panelists who are leaders in the field here with us today. I'm going to be introducing each of them individually before they give their individual presentation. And the format will be that followed by questions, some that I will ask and some that you will ask, hopefully. Hopefully you more than me, but let's see how it goes. Before we begin, let's just put the discussion in some context. So you've probably heard more than 60,000 times that we have had a record high homelessness of more than 60,000 homeless people in the city shelter system, in the recent past. And but what you may not know is that the trend is ticking downward now for the first time in a very long time. And I think the Commissioner, Steve Banks, will be able to talk about this better, and as Lorraine will, but we're down to like 56,000, and we're continuing to trend downward. So one thing I would hope that we can get into today is why is that happening? What are the drivers in that? How can we keep the momentum going on that? And what's going well, and maybe where are we stuck? A second area that I think I'd like to get into is supportive housing, because this is the Supportive Housing Network Conference. And supportive housing has proven to be one of the most versatile and effective interventions that we know in our time. It has proven to be effective. It's inextricably linked with homelessness, but it's been effective, starting out with mentally ill individuals, but we've shown that its effectiveness with families with a mentally ill parent or disabled parent, youth aging out of foster care, domestic violence, and the list goes on. And so, we're looking at a new line of supportive housing coming in, 5,200 units, which were recently approved. And so where should the emphasis be, on those, given those various populations? What should the rollout of that look like? And where's the need in the future? I think those are questions that I hope that we get to today. So with that, I'm going to introduce the first speaker, Kisha Santiago-Martinez, who serves as the New York State Assistant Secretary for Housing in the Governor's Office. And she is working across state agencies to expand the state's housing portfolio and to better leverage government and private resources to help meet the critical and diverse needs of New Yorkers throughout the state. Prior to joining the Governor's Office, Ms. Santiago-Martinez served as Assistant Commissioner of New York State Home and Community Renewal, where she created and managed the Office of Budget and Operational Strategic Management, whose mission is to guide the development, alignment, implementation, and management of HCR's strategic and transformational initiatives. I'm going to stop there. I'm not going to go into where she went to college and graduate school, and I'm going to turn it over to Kisha.
Well, good afternoon, everyone. First off, thank you. Good afternoon. First off, I just want to thank the network for inviting me to be a part of the panel. I started in my post early February. I think I met members of the network on my second day, perhaps, in my new job. And that really sort of speaks to just what high esteem we hold the network and how great they work with us as partners. We try to figure out how we're going to solve the gap and really make sure that we're aligning our resources in the appropriate way. They do a great job at bringing the right people together to help us get it done. And so I always look forward to meeting with them throughout the year. So thank you so much for inviting me to be on the panel. So I know that there's 3 million people who are, putting 30% or more of their income into housing. And so we know that there's this humongous challenge. And then when we add the population of people who need supportive housing on top of that, the stressors on those families and those individuals just continue to grow. And so we've really been working and trying to figure out not only what we do with our general affordable housing projects, but how we can make sure that we're aligning our resources into helping them so that they either don't reach that breaking point where they actually do become homeless, so we can catch them when they're at risk, or we can address their needs quickly when they do become homeless. So I'd like to talk a little bit about what we're currently doing and then what we're trying to do just a little bit differently. And I think my position as Assistant Secretary for Housing is a good example of what we're trying to do a little bit differently. So my job is 100% focused on housing, which when you start to dig in, you realize just how broad housing is across the state, across the different state agencies. I have my hands in a lot of different people's pockets, and we work really well together. So that level of not just interagency, but with different cities and throughout the state, but also at the cabinet level, and really sort of increasing the amount that we work together so that we can, make even more achievements than we have so far. And with that, we know that the governor has been a long-standing champion for affordable housing, not just through the state, but also throughout the country. So one of his very first charges was looking at ways to overhaul the Medicaid system, right? And part of that was creating the Medicaid redesign team, which includes different state agencies. It also includes our partners like the network, and really focuses on improving not just delivery of programs, but making sure that it's more cost effective for individuals who are struggling with homelessness, mental health, and concurring different health issues. In addition to that, the governor announced the House New York, the $1 billion program, which is on top of existing and regular housing investments. And that is with the goal of creating 14,300 units, and HCR is well on its way. Throughout my presentation, I'll be talking a little bit about OTDA, the Office for Temporary Disability Assistance, but I'm going to let Sharon really focus more on that. So I'll be talking a little bit more about homes and community renewal and some of the other work that homes and community renewal is doing with the other state agencies like MRT. So for 2014, that was a record year, especially for HCR, but a lot of activities that happened with their work in coordination with other state agencies. So for the state, we're really proud that in 2014, we were able to create 9,407 affordable units, which included ownership, and that included supportive housing units. So for you all in the crowd that want to hear some supportive housing numbers, since 2011, the state has awarded 79 supportive developments, and that's really important. That's in New York City as well as throughout the state. And that includes 3,194 supportive housing units specifically out of the 6,000. And included are 23 developments that were awarded just since this January. So not only have we been, continuing that commitment, but I think to a degree, the numbers that I'll tell you today will show just how much we're ramping that up and making sure that we're protecting the most vulnerable of New Yorkers. So since January, we've closed on 639 units that are supportive housing units out of 1,500. The other thing that we're doing is we're constantly looking at ways of tweaking existing programs to make sure that we're improving those programs in the way that we deliver it, both from the developer and the builder side and the service providers, but also how quickly it gets out to the tenants of those units. So for the first 3 RFPs on MRT, it was 100% focused on HCR matching those MRT dollars with bond projects. And since then, we've changed that. But 8 projects have closed, with 498 being supportive housing out of the 987 units that have closed. And then approved are 337 with another 9 projects in consideration. So again, really ramping up and focusing on supportive housing as a part of a general portfolio, which I think is extremely important. I sometimes or often like to say to folks, we're committed to supportive housing, and we would be doing that anyway, but we're also extremely proud of making announcements like New York 4 initiatives. But it's important to note that we're committed to this, regardless of a special initiative, that this is something that we just see as important throughout the state. And with that, last year HCR made MRT resources available statewide. So can you not hear me?
I'm sorry, but when you use the acronyms like
Oh,
MRT,
I'm so sorry.
don't understand.
You're right, you're right. I'm sorry, that's my fault. I'm in an alphabet soup of, and it's even worse when you try to translate it over to New York City programs who have their own acronyms. So my apologies. MRT is the Medicaid redesign team, which the governor started when he came in 2011 in order to figure out ways of making, overhauling the Medicaid system and creating cost-effective ways of helping people who are homeless and had different health issues. So I will be more mindful of the acronyms, so my apologies. So statewide, 2 projects have closed, one in Long Island and one in Mount Vernon, and there are several other that have been approved in Buffalo, Canandaigua, and Monroe County. Again, trying to take different, not necessarily pilot projects, but taking projects, figuring out how they work, programs, figuring out how they work, and then figuring out how we can make it successful across the state. So in total, close to 1,000 units have been approved or under construction for high Medicaid users under the Medicaid redesign team's capital programs through Homes and Community Renewal. And overall to date, $107.15 million in Medicaid redesign capital has been made available through RFPs, with $81.9 million being awarded. So these are accomplishments under that initiative since 2011 that we're just extremely proud of. And if I zone in a little bit more on homelessness, with making sure I don't overlap too much with my other esteemed colleagues on the panel, for New York City alone, the state currently spends approximately $635 million on homeless services and programs administered and overseen by the Office for Temporary and Disability Assistance. That includes homeless shelters, development of new homeless housing, homelessness prevention activities, and rental assistance programs. I'm going to rattle a few more numbers off, even though I know they're maybe a little boring, mainly because the 15-16 state fiscal year enacted budget I'm extremely proud of, and and is already underway. So I just want the people in the room to have a sense of what funding is around out there, how that funding then yields into units for the communities that we all care about. And then I will stop with the number rattling. So in the budget, we're investing $432.2 million in homeless services, with 367, and this is additional, with 367 million specifically targeting New York City over the next few years. 191.5 million of that is from the J.P. Morgan Chase settlement funds, and that portion of the funds is to support the New York 4 initiative that I'll talk about in a little bit, which, as Tony mentioned, is going to create 5,200 new supportive housing units throughout the state. That also includes New York City's Link 1 rental assistance program, a cap on the recent contribution for public assistance and recipients who are diagnosed with HIV/AIDS to make sure that their rents remain affordable for them. And on top of the targeted and specific homeless housing resources that are available are also the general affordable housing resources, which come out to $486 million for affordable housing, predominantly through Homes and Community Renewal, with $63 million of that coming from the Office for Temporary and Disability Assistance Homeless Housing Assistance Program. So a bunch of RFPs are already out there. We're starting strong where we can. We're moving forward to make sure that the projects continue to flow throughout the pipeline. And one of those items is New York 4. So New York 3 has been wildly successful in my book. We're in the 9th year of it. We are very, very close to closing out. That was a New York City specific program. And we've really taken the opportunity, and also in communication with members of the network, to learn where New York 3 went really well, and where there were areas and still work to be done so that we can make sure we're implementing those improvements into New York 4. I think Tony touched on them a little bit. But one major change, and I think is reflective again of my position and where we're going to operationalize interagency coordination, is the creation of an interagency council. And that may not mean a lot to you, but at the cabinet level, I'm leading that effort. And that means that we're working with multiple agencies, not just those who have financial skin in the game, so to speak, where their capital dollars are being associated with the New York 4 initiative, but also the agencies whose populations might be served by it, which would include, there's some acronyms, I gotta tell you, I don't know what they stand for, like DOCS. I will be really honest, but when we're talking about youth who are aging out of both foster care as well as youth who are coming out of the criminal justice system, who are very much at risk of homelessness when they come out. So we're really setting that up, and we've already started, and we're working on creating not just working together, but also reporting numbers together so that we're really feeding back information back to the network and the community so they know where our successes truly lie. The other difference is it's 5,200 units over 5 years. New York 3 was 10,000 over 10. So we listened on the shorter. I know everybody wants more, but we're really proud of that number, and we're always looking to try and figure out ways of growing. Upstate communities for the first time are eligible, and that, again, is important for us. There, homelessness and combining that with other supportive housing needs isn't unique to New York City, and we wanted to make sure the upstate areas had an opportunity to compete for those funds as well. And I think the other thing is we're growing a bit on the vulnerable populations, and really that list has come with a lot of feedback from the community. It's the community, and the breaking of the silos also means allowing a little more flexibility within New York 4 that we didn't have with New York 3. So one thing that was extremely important to me and to my colleagues was that we had an opportunity to take a look and analyze both the proposals that are coming in, geographically where are they, as well as which populations are the development community very not only able and have the capacity to serve, but where they're most comfortable. We all know that sometimes there are particular populations that communities fight a little bit hard against. And we wanted the flexibility to make sure that we could reassess throughout the 5 years and really identify if there are populations that we know need help and are not getting it all served. Do we need to educate? Do we need to work with our partners to advocate a little bit more for particular populations? Are we at the state not doing the best that we can in order to identify specifically what would be good for those populations, and working with our partners to encourage the development community to support them? So we really didn't want to do what we did in New York 3, which was identify exactly how many units would go to exactly which population. I think that's probably one of the more major changes, which then kicks into implementing New York 4 and the challenges of that. But we are sticking to our guns on that. We feel really strongly that it's important to have a little bit of flexibility to do a feedback loop and assess what's coming in, who we're serving, and who we're not serving. And have the ability to respond to crisis that may happen in 3 years that isn't quite happening this year. So that was extremely important, and I think something that's really worth noting, the difference between the New York 4 and New York 3. Over the next few weeks, you'll hear a lot more from us with regards to the implementation. So there's some capital RFPs that are already out there. But what we're looking to do is help the folks who are applying to these RFPs so that they're not running around from agency to agency. That was some feedback that we received from the network members when we really took that to heart. So we're figuring out ways to streamline that process through the interagency council. so that it makes it easier for both the service providers and for the developers to apply for funding, get funding, and move quickly into implementation. So we're trying to work out the back end stuff on behalf of the successful projects so that we can keep moving quickly. And one other, I guess, piece that the network wanted me to talk a little bit about is the National Housing Trust Fund resources. I will say that we are all always looking for additional resources. The state is, developers are, service providers are, and there's still limited information that's out there. So my response, my ability to speak in depth at this point is a little bit more limited, but I will say that the agencies within the state have become extremely well-versed and masters at doing mixed finance deals. So we're eager for any additional resources that are out there to become available. These particular funds are for extremely low income, which obviously helps to serve our population that we're talking about today. So we're definitely working to try and get those resources in and make them available so that we can continue to build on the affordable housing and, most importantly, the supportive housing that we currently do. So in closing, I just want to talk about some things that are extremely important next steps. One is further breaking down those silos. I'll be honest, the state agencies actually do a lot of coordination that's unofficial. They just have good relationships with one another. And my goal and any of my positions and any of my jobs has always been, how do I make this better so that when we're all gone and us who we get along very well and we're working well together, if we're all gone, that work continues to move forward. So that's one piece that we're doing. The other is identifying and implementing efficiencies to make the process easier for both the folks who are looking to build and provide services, but also so that we can help get people in their homes quicker. We're also looking to keep better track of our successes and the interagency council and getting that information together as part of that, and analyzing our projects on a more regular basis so that we can identify whether next year's RFP needs to be tweaked to make sure that we're accounting for and taking care of our most vulnerable populations. As well as trying to push innovation within the industry, because let's face it, this is New York. We should be doing, I think, the most awesome work. And then also leveraging resources as much as we can so that we can make the most out of state and city resources. So thank you again for the opportunity to speak. I really do look forward to continuing to work with you all.
Thank you, Kisha. That was very informative. You know, this piece about, I was glad to hear what you said about the siloing. For those of you who are not familiar with it, in New York 3, in the previous agreements, there was a very exact number set to the population. So so for families, you had X number of units. Mentally ill, you had so many units, and it was fine in the beginning. But then as it wears on, and you get down to where the numbers start to dwindle, you've got 4 left in this category, 70. It's a little bit like a going out of business sale, and you can't find your size. So it was good to hear this. And the other is that the National Housing Trust Fund, the importance of us. There's $20 million attached to that, and so, and as Kisha said, it's for very poor, developing housing for poor people, and so that's something for us to keep an eye on as a supportive housing community. So let's get a city perspective, do the state-city thing. And so I want to introduce Commissioner Steve Banks. Commissioner Steve began his appointment as Commissioner of the New York City Human Resources Administration, or HRA, in April 2014. As Commissioner, Mr. Banks serves as Chief Executive of the largest social services agency in the country, which serves over 3 million New Yorkers throughout the administration of more than 12 major public assistance programs with 15,000 employees and an operating budget of over $9 billion. Before coming into city government, Mr. Banks was at Legal Aid Society for over 30 years, and the American Lawyer has listed him as one of the top 45 public interest lawyers in the United States. The Daily News described him as perhaps the city's most legendary legal aid attorney in this generation. And New York Magazine called him one of the most influential New Yorkers. So with that, introduce Commissioner Banks.
Thank you, Tony, for that introduction. If only my mother was here to hear it. Just like I can assure you at home, I still take out the garbage. Obviously, I'm new to government, but I've interacted with government for many years. And among the things that we have been focused on at HRA is embracing what I think is the role that HRA should properly play in partnership with the Department of Homeless Services in the city, which is a role of preventing homelessness. And the old adage, an ounce of prevention is worth a pound of cure, is well worn, but it is certainly something that historically had not been played, had not been a role that HRA had played. And I think when I spoke here last time was right after I had, last year, right after I testified before the council, very shortly after becoming the commissioner, and I had said that we had analyzed our data for 2013, and we found that 23% of the applicants for shelter had a HRA case closing or an HRA sanction within 12 months prior to applying for shelter. As I said, we found that an analysis of the HRA caseload of the DHS applicants for shelter based upon a cohort in 2013, we found that 23% of the applicants for DHS shelter had an HRA case closing or sanction within 12 months of applying for shelter. That's certainly bad repeating, so it was good that somebody in the back asked me to repeat it. And so, as many of you know, we've been embarking upon a whole range of reforms at the agency over the past year to address case closings, to address fair hearings, to address all the kinds of problems that have built up over the course of about 20 years. In the area of homelessness, however, we in partnership with DHS have very much focused on, as I said, the importance of preventing homelessness. And so we created within HRA a part of the agency that had previously not existed, the Homelessness Prevention Administration, very much focused on that role. Within it, we've brought together different disparate parts of the agency that have been focused on prevention and have added some new elements. And let me just summarize what they are. We have homelessness diversion units, which are really prevention by another name. They've existed for many years, and they're located at the HRA centers around the city and also at DHS's PATH facility and other entry points to the shelter system. And they're now utilizing a whole range of new tools, including short-term financial assistance, to try to help people remain housed in the community. We've also deployed staff at the DHS home-based sites around the city and at the Housing Authority Administrative Hearing Office, in addition to the staff that we'd had previously in the Housing Court. And the importance of deploying staff there is we want to be sure that there's no wrong door. So if someone comes into a home-based center facing eviction, rather than have the home-based staff have to send them to HRA to evaluate whether or not they would be eligible for a rent arrears grant, we want the HRA staff right there on site working with the home-based staff to try to intervene as quickly as we can. Similarly, we deployed HRA staff at the New York City Housing Authority's Administrative Hearing Office from the same perspective, because we wanted to make sure that we could intervene at the earliest possible moment where potentially homelessness could occur at the Housing Authority. And for many years we've got staff, or had staff, in the housing courts, and we've enhanced their role over the past year. We also have a landlord ombudsman unit, which is developed in terms of expediting services for landlords when they call needing replacement checks and the like when checks aren't delivered. That's an important part of the puzzle to ensure that we have services available for landlords. We also have created an early intervention outreach initiative, which is an initiative to reach out to families and individuals on the verge of eviction and connect them to legal services and connect them to HRA's own programs to prevent eviction. And we created a rental assistance program to implement various rental assistance initiatives. In the budget for the July 1 fiscal year, HRA will be administering in partnership with DHS rental assistance programs aimed at relocating 8,500 households from the shelter system over the course of the next year. That's a new HRA program. We also manage the city's legal services programs now. For years, these were sort of a patchwork of programs all around the city at different agencies, and under the mayor's direction, they've all been brought together under one roof at HRA, and the funding has been dramatically increased. During the prior administration, for example, the investment in anti-eviction legal services was in the tune of approximately $6.5 million. When fully implemented, the investment in anti-eviction and anti-tenant harassment programs at HRA over the course of fiscal 16 will be $50 million, growing to $65 million in FY17. So there's been a substantial, unprecedented national investment in eviction prevention through these programs at HRA. And we also created a central rent processing unit. When I came to the agency, I learned that we were writing checks, I do mean checks for rent, at all the locations around the city. And therefore, if the person responsible for typing the check was out, there was a delay, and one of the first things I did before I became commissioner is I met with housing court judges, I met with the Rent Stabilization Association, I met with tenant advocates, and there was one common complaint about getting rent arrears checks when cases were in housing court. In particular, we didn't pay based upon the date, we paid based upon the order in which the checks came in. We changed that system, and now we have a central rent processing unit in which the checks are paid to meet the pay dates, and the money is actually paid to the Housing Authority by electronic benefits transfer payment, just like many of you in this room make your payments. And all of this is adding to much quicker, more effective payments, and many more interventions to prevent evictions, all of which we think is beginning to have an impact in terms of applications or applicants for shelter. I want to just describe in a little bit more detail the rental assistance programs that we have. They're under the rubric of the Living in Communities rental assistance programs. And so one program was developed for working families, another was for families with multiple shelter system stays over a period of time, another was for survivors of domestic violence, and then a fourth, for the first time, was rental assistance for seniors and for adults receiving supplemental security income, Social Security disability, or veterans disability benefits in order to promote relocations from the shelter system and to address chronic street homelessness. This is the first type of rental assistance the city has had as a city rental assistance program for single adults or adult couples. It was also a rental assistance program for working adults and a rental assistance program for families with children currently in shelter to help them reunite with families. Over the course of FY16, beginning July 1, HRA will also be administering a federal home tenant-based rental assistance program for families or with children or without children that have an adult or a child receiving disability benefits, given the importance of ensuring there's ongoing rental assistance for those households. The next slide is just a snapshot of what we've been able to do really between December 2014 and April 2015. The HPD and Housing Authority priority relocations that we work on together with DHS, which really does the tremendous work on the ground in terms of making sure those referrals happen with our partners at the Housing Authority and HPD, began before December. But the link rental programs, although they were announced in September, we found that we needed to pay the HUD fair market rental value, and that increase happened in December. And you can see that overall, there have been more than 4,000 households relocated from the shelter system and 12,000 men, women, and children during the process of this relocation effort. And so the effort is really one of trying to relocate people from the shelter system in partnership with DHS, and also to work together to prevent homelessness at the front end, to begin to address the numbers of people in the system that have built up over a long period of time. The last slide just highlights the tenant-based rental assistance program that I described, which is a federal home program which is transferred from HPD to HRA. There's a lot of budgetary language here. It's a slide from a budget presentation we made recently, which we just wanted to share with this group. And then a new program We have great partnerships with the state, and for many years the state ran a program called State FEPS, Family Eviction Prevention Supplement, which was meant to address gaps and the rental assistance shelter allowance for families and rent in the market. And the city wanted to move ahead with a new initiative, which we have great partnership with the state, and we continue our discussions with the state in terms of expanding these kinds of programs and implementing these kinds of programs. The City FEPS program is an effort to try to prevent families from coming into the shelter system, as well as domestic violence survivors who have come in and trying to rapidly reattach them to housing. And we're having great success so far with the relocations that just began during the month. And every day there are more families who have been able to either relocate or keep from entering the system. So we're going to continue with these efforts. And I would just want to emphasize, I've said it a number of times, partnership. I think that the partnership with DHS is actually what is making HRA's programs effective. And I think the feeling is mutual in terms of the work together, and also the partnership with the state is important to us as we develop these programs and move forward. I know to us, working with Executive Deputy Commissioner Devine has been particularly a good working relationship, and I don't mean to butter you up just because you're our state supervisor, but you come out of the housing world, and that is particularly important, we think, in moving forward these issues. So thank you for the opportunity to update you on what we've been doing in terms of prevention and rental assistance, and I'm sure there'll be questions when we get to that point.
Thank you, Steve. You've been busy. It's good, really good to see what's being done around prevention and particularly on rental assistance, because it's widely thought that one of the main drivers of homelessness going up in recent past has been not having these strong rental assistance programs. So it's really great to see them. So I'd like to introduce next Sharon Devine, who is the Executive Deputy Commissioner of the New York State Office of Temporary and Disability Assistance, or as we more commonly know it as OTDA. And OTDA is responsible for overseeing programs that provide assistance and support to eligible families and individuals, including providing temporary cash and food assistance, overseeing New York State's Child Support Enforcement Program, determining some aspects of eligibility for Social Security disability benefits, providing assistance to immigrant populations, and supervising homeless housing and services program. 24 years of Ms. Devine's career has been spent in New York State government. This has included the State Department of Education and New York's Division of Housing and Community Renewal. So she is clearly dedicated to New Yorkers and has been at it some time. And with that, I give you Commissioner Devine.
Thank you, Tony. I'm going to be the first presenter to stand up, but it's not because I'm a show-off. Not at all. I just have a number of slides, and I'm also not going to be long. But I, would hate for the young lady to have to come up here every time I wanted to fast forward my slides. So. And
she's thoughtful.
And I'm thoughtful. So, with being thoughtful, thank you for the introduction, and thank Shenny for inviting me. The staff, the board, as well as the members have been vital to New York State's effort in the area of combating homelessness and providing supportive housing. So I just want to say before I begin that the work that you all do just plays such an important role in homelessness and, helping people that are impoverished, really get themselves out of poverty and really help to rebuild and stabilize their lives. It's a core and a center to what a family and a person needs before they can begin to work on other things. And so with that, I just want to thank you all, because it's something that we cannot do alone. The state cannot do this without the partnership of the city. We can't do it without the partnership of the not-for-profits, without the partnership of the network, the developers, and everyone who is here, obviously and clearly has, you can applaud yourselves. So I'm not the only show-off in the room, okay? With that in mind, though, you get the picture, is that this is something that happens, that has to happen collectively. We didn't get into this in one day, and we're not going to be able to get out of the situation that we're in one day. So it's going to take time, and it's going to take a collaborative effort, lots of different program resources being pulled together in order to work on it. So with that in mind, I'd just like to share a little bit about my background before I go into my presentation, because it's so important to me that you understand that this isn't just a professional sort of goal for me. This is a personal goal. When I was 18, I was going to college, and of course I got a full tuition scholarship, but I did not get room and board. And my parents were not rich in any sense of the terms, but of course I had that 18-year-old vigor, and I decided I was going to go out of state to college with my full tuition scholarship, and I was going to work at some pizza joint in order to get room and board, to pay for the rest of what I needed, because my parents just couldn't help me. So I head out to Atlanta, Georgia, and very quickly find myself for the next 3 years really struggling. And although I was not homeless, and obviously the story turns out okay because I'm here, it was 3 years of a battle of me facing that every day and trying to figure out what I was going to do and how I was going to make it over that course of time. So again, for me, it's personal. I also have a disabled son, and so, you know, at some point in his life, he's going to need supportive housing, and I know he is. He's only 12 right now, but and in some future years, 20 or 30 or whatever, you know, whenever I can't take care of him anymore, he's going to need some of these programs and services. So for me, it's professional and it's personal, and I'm in it so that this is lasting and we can really help people. So with that in mind, what have we been doing for tackling the homeless crisis? So housing, just in particular, supportive housing is critical, and it's one of the fundamental components to the system of benefits and supports that we need to provide for reducing homelessness. It also really helps assist those vulnerable populations really with independence, and that's what we want. We want them to be independent and capable of helping themselves, and that only helps us as a state and as a society. So the New York State Office of Temporary and Disability Assistance has really placed a very high priority on the provision of our resources to help reduce homeless housing. As we all know, New York State is a leader. I think Kisha pointed out that, you know, we are definitely a national leader, but, you know, we understand in this room at the state and city level and, you know, within the advocates that it really takes more than just bricks and mortar in order to humanely provide housing for vulnerable populations of our society. So funding from our homeless housing assistance program really has been crucial in helping us do this. And so the homeless housing assistance program is the first program in the country to really target substantial financial resources for the development of homeless housing. It aims to address homeless issues throughout New York State by funding a broad range of housing options and a broad range of diverse housing populations in the state, as far as urban communities, suburban communities, as well as, you know, rural communities. It's, you know, it's a problem that exists throughout, not just in the urban areas. So HHEP provides grants and loans to not-for-profit organizations, charitable organizations, religious organizations to acquire, construct, and rehabilitate housing for persons who need the additional assistance and help. Again, HHEP is one of the first in the nation. It was established in 1983, and we have contributed toward the development of nearly 17,000 units of housing across the state, and that's 30,000 beds of housing. So let me drill down just a little bit more and talk about what we did with our funding last year, just by way of an example. As Kisha has mentioned, I know she's with the governor's cabinet and works very hard on these issues, but Governor Cuomo himself has long been a leader in this area in the development of supportive housing programs, and something that he's continuing to do. As an example, this year is the second year in a row that our funding was doubled for the homeless housing assistance program. It's been historically at the $30 million level, and last year went to $63 million. And this year, for 15-16, which I'll get into in another slide, it's at 63.5 million. So we're inching and climbing up to where we need to go. So supportive housing, of course, like I said before, is a partnership with not-for-profits, developers, providers, and, you know, with all of the people that are in this room, and it's going to help create, this particular funding is going to create 17 projects during the last state fiscal year, and that was 500 beds or 500 units or 1,100 beds of supportive housing. And this ranges from housing for survivors of domestic violence, for veterans, to individuals who are formerly incarcerated, or someone living with HIV/AIDS, mental illness, or substance abuse issues. So 2014-15 was a good year, and I think I just walked you through some of the accomplishments of what we were able to create. So this is what we actually had in construction in 2014. There were 14 projects that had been previously awarded in prior years. This work resulted in the preservation and or creation of 600 units with more than 900 beds of housing. And that represents a $36 million investment just last year. So these projects all run the gambit of the size and the scope and the population, as well as the geographic location. Many of these projects are built with our sister agency, New York State Homes and Community Renewal, with New York City agencies, HPD, localities, and as well everyone in this room. And let me just show you a few of those projects and why they're so fantastic. So this project happens to be one from the Binghamton and Broome County area. This particular project was able to preserve 54 supportive housing program units, and it provided emergency, transitional, and permanent housing for single women and their families in Binghamton. And I think it's even more heartwarming that we all know that YMCA, while it was created over 160 years ago to help young men with their whole wellness and healthy being, it has, of course, evolved into lots of other areas of supports and helps. And so this one is a great project. The next one is Morris. That's New Destiny Housing Corp. This project is right down here in New York City. It's in the Bronx. It's 39 units of housing. That's 19 permanent supportive housing units for homeless families that are headed by survivors of domestic violence. This particular project is really interesting because there are other affordable housing units in the project, so you might have middle, low income, as well as project tenants from our population as well. So it's a good example. The next example is a project in Amityville, the Concern for Independent Living in Liberty Village, a larger project, 60 units for veterans and their families. So again, we did this in collaboration with HUD and the VA. And again, it's an outstanding project. It's beautiful and just a niche need. The last one I'll highlight is Thompson County Community Action, the Mongolia House. This was a brand new building. It's absolutely beautiful. It was in Ithaca. It was 14 units, so rather small, but still, you know, serving the niche populations that are needed out there, single adults with substance abuse issues. This particular project was a little bit of a challenge because Ithaca happens to be a really high-cost area as far as the creation of housing. So this took a little stretching and a little pulling, but we accomplished it. So I show you these projects just to give you a sense of the HHAP program and the fact that the program is really you know, statewide, and so the need is statewide, and our footprint is then you know, statewide. So let's talk a little bit about the populations that have been served under the HHAP program. So these are statistics from 1993 to 2014, which just give you an overall sense of how we're serving the populations. And so we, of course, have mentioned the fact that we serve individuals and families, mental illness, HIV/AIDS, substance abuse, adolescents who are aging out of foster care, teens who become parents at a very young age and may need housing and can't stay at home, DV victims, elderly, veterans, as well as individuals leaving correctional facilities. So the majority of the population within the HHAP world is about 38.6%, and that's mixed populations. And I think the next biggest range is 20%, which is populations with mental illness, and then substance abuse at nearly 10%. So this is where HHAP housing has gone. And I think it's important to note that the projects are really throughout the state. Down at the bottom of this particular slide, you'll see the bright yellow and the really deep, deep blue. And so we have 199 projects that we've created in New York City and in the suburban surrounding counties out on Long Island, Nassau, and Suffolk County, as well as the Westchester areas. There are another 106 projects. And the rest of the state, which is the deep gray, is 323 projects. So footprint is wide. So supportive housing. HHAP isn't the only way that we address the homelessness and the need for temporary and transitional housing. We also participate with New York, and it should say New York 3. My bad. So we were a signatory for New York 3, and we were charged with the development of 1,000 units of supportive housing for chronically homeless single adults who suffer from a serious and persistent mental illness, or who are diagnosed with mentally and chemically addicted. So to date, HHAP under New York 3 has funded 1,940 units of housing under the various populations that I previously identified. And this, of course, is in collaboration with other funders and other state agency resources. So the Medicaid redesign team, I heard the woman here ask about what was MRT, and so here's a depiction of our efforts within MRT. HHAP administers, in collaboration with the HHAP program, we have administered MRT funds for supportive housing, and to date we've funded 310 units, totaling $37.8 million. This year we have an additional $10 million right now to spend, and so we'll be looking to issue an RFP soon. And so keep your eyes peeled for that if you're interested in, you're here and you're interested in funding. So what does an MRT project look like? So this is Providence Housing Development, 21 units out in Rochester with single adults that have mental illness or substance abuse. There's also a project in Canandaigua, and this is for Finger Lakes United Cerebral Palsy, 20 units including 7 single adults with developmental disabilities, physical disabilities, and or traumatic brain injuries. And the last one I wanted to highlight was the Matt Urban Center, and this one is particularly heartwarming for me again because it's a project where it's 20 units, it's women who have had ongoing health and behavioral issues as well as sexual abuse. And so this particular program is wildly successful, and it's been able to take women who have been very long-term on the street, maybe through prostitution or some sort of sexual ring, whether willing or unwilling, and into these homes. Women that would not be willing to come into a shelter are now in this shelter. And that's one of the beauties about the HHAP program. It can really reach down and do niche populations of need where needed. And so we're thankful that we have the ability to participate in New York for and use the funding to get at whatever the needs are that come about within that 5-year period under New York. So if you're in the room and you're wondering how a not-for-profit or a developer, or if you're a project collaborator in some sort of sense, how you get to participate, we of course issue our funding through open round RFPs, and so open round means that, you know, we collect applications, evaluate them, and award them on a rolling basis. And so therefore, after funding is exhausted, it's gone. So at this point in the stage, we did release our RFP on May 1st. We began collecting applications on May 29th. And again, we have $63.5 million to spend in addition to our MRT money. So, homeless services, you know, the HHEP program and MRT program really focus on the capital side of the program. And we do have additional programs that focus on the homeless services portion. One is the New York State Supportive Housing Program, or NYSHEP. The other one is Solutions to End Homelessness Program, STEP. Both of these programs are used as cornerstone services that really assist in addressing homeless housing needs throughout the state. So it's okay to create the housing, but you gotta wrap some services around them in order to make it viable and make it a long-staying option for families. And so that's what this helps do. So beginning in 2011, if there's some old timers in the room who remember that there were a lot of different housing-related programs, services-related programs, under Governor Cuomo's leadership, we collapsed those into two major programs. And I know that there are a number of people who advocated for the increase of funding that we received this year, and I just say thank you. It was an additional $2.9 million, which I'll show you on the next slide, but I just wanted to say thank you for those who worked on that. So NYSHEP. NYSHEP is particularly helpful as it has 16,500 units for that it supports for single adults, families, and runaway youths. And this, you know, program really focuses on housing stability and achieving greater living independence. And so annually we have approximately $2.6 million. And of that 16,000 units, 14,000 is for single adults, 1,400 are for families, and for young adults, about 240 people are served under this program. So under the STEP program, similar successes that we can report there. This particular program helps service 37,000 individuals who have been assisted with prevention services, and actually 4,500 individuals have moved out of crisis and into permanent homes as a result of the STEP program. Each one of these programs are funded via RFP contracts, so pay attention to our website, and as we release RFPs for these services, you'll be in tune with that. So I guess I just wanted to say thank you for the time here, and I am here after this particular panel. If we don't get through any questions you have, I am here, as well as several of my team members who are sitting in the front, and we're happy to talk with you about any specific questions that you might have. And again, remember, we got to do this together. Thank you. Thank you.
Thank you, Sharon. That was great. Particularly adding the personal dimension to that. Appreciate that. And also, I mean, if you've gone to conferences outside of New York, housing conferences, and what other states are doing, it's pretty impressive what, you know, the amount of money and effort that New York puts into housing and support programs. So I'd like to introduce Lorraine Stevens, who serves as the first Deputy Commissioner for the New York City Department of Homeless Services, or DHS. And she also brings 25 years of leadership experience working for the advancement of the underserved, children, individuals, and families. DHS is one of the largest organizations of its kind in the United States, committed to preventing and addressing homelessness. As first Deputy Commissioner, Ms. Stevens is responsible for collaborating with other public agencies and not-for-profit partners to work to prevent homelessness before it occurs, reduce street homelessness, and assist New Yorkers in transitioning to permanent housing. She is the lead for all capacity management efforts across all divisions and oversees all agency public-private partnerships throughout the agency. Prior to being at DHS, Ms. Stevens served as Assistant Executive Director at Catholic Guardian Services, and before that, as the Deputy Commissioner of the Division of Family permanency services with the New York City Administration for Children's Services, ACS. And with that, I want to introduce Lorraine.
Thank you. Good afternoon, everyone. So one of the things we realized very early up front during this administration is that it takes a village to actually deal with this problem around homelessness. So on that note, I cannot do my presentation in the PowerPoint, so John, can you come up and help me? Because we did realize that quite up front. When Commissioner Taylor and I entered DHS over a year and a half ago, we had over 12,000 families in shelter, close to 10,000 single individuals. And our capacity was very, very tight, quite challenging. And one of the things we realized, like I said up front, was that we had to partner with all of our sister agencies, HRA, Dept, ACS, the state. We also had to look at our non-for-profit providers and say, how can we together address this issue and this challenge and crisis of homelessness? But we've come a long way in the last year. When we started off, there was no rental assistance programs, and Commissioner Banks talked a little bit about our initiatives around rental assistance. But as of today, I'm happy to say our census is at 56,448. It's coming down, 3,000 families less than what we've seen since October. That includes 11,673 families, 2,147 adult families, and 11,927 individuals. So this, thank you. From where we started a long time ago, we definitely need to clap about that. But there's a lot more work to be done. But today I want to talk a little bit about our plan, talk a little bit about the families, and talk a little bit about why supportive housing is so important. Just in terms of DHS, to give you a scope for those that don't know, we're 2,000 employees. We have a $1 billion budget. There's 282 shelters in all 5 boroughs, 9 directly run, 70 non-for-profit. In terms of what shelters look like, for families with children, we have 95 tier 2s, 47 hotels, and 18 cluster sites. And when I say cluster sites, those are multiple apartment buildings throughout the city, which can include over 3,000 cluster units. On the single adult side, we have 77 shelters, 12 annexes, that would be like YMCA beds, 8 hotels, and then 1 veteran shelter. And on the adult families, we have 13 hotels, 9 contracted, and 2 directly run. One of the things we realized very quickly is we had to be very clear with our non-for-profit community. Next slide, John. Thank you. Based on what our operating principles are and our core values. And one of the things that we understand is that in New York City, there is a legal mandate to shelter. But how do we actually move forward with executing that legal mandate? And how do we do that with compassionate care? How do we create a sense of hope with our families? How do our staff and our non-for-profit providers do that with integrity? So when we bring on shelter, it's appropriate for families. It's appropriate for singles. It's safe, that people are actually coming to the front door and believing that they will get the help that they need. And how do we create a sense of resilience? That just because you're homeless, that you can have all the necessary resources so that you can remain in your community. And how do we work on that? Next one. And so we decided that there were 5 goals that we needed to work on in order to move this work forward. The first being preventive services. And so I'm happy to say our home-based services, which is a nationally known preventive program, has shown to be 95% effective. And we increased that funding this year from $22 million to $42 million because we believe that if we are able to maintain people in their homes, that will reduce this number of homelessness. We've expanded our sites from 14 to 23 sites. And last month alone, just in terms of what the need is in New York City, over 1,000 families showed up at home-based services for services. In terms of outreach and working with our street homeless population, we have been committed to kind of going out and increasing our subway teams. We actually took over street outreach in the subways and go to 468 stations throughout New York City to work with our street homeless population. We developed additional safe havens and transitional beds, as well as stabilization beds. And that includes, for safe havens, 545, and for stabilization beds, 326 beds. Shelter has been the most challenging for us this year, recognizing that it's an infrastructure that has not been supported through many years, and that we heard that quite clearly from our non-for-profit community. And so one of the things that we realized is that we need to increase our social services in the shelters, and been working conjunctionally on putting social service staff in the shelters. We're going to be hiring 37 permanency specialists, which are social workers, that are going to be working directly with our non-for-profit providers this fiscal year on helping families to move to permanency. We will also be putting a social worker in each shelter that'll help in terms of care coordination for those that are experiencing mental health issues. Well, thank you. It's coming, it's coming. So in terms of the case management model, we believe that we need to have a consistent approach to how we work with families. Each and every provider, as well as each and every direct run shelter, should know how to work and engage families. And so one of the things that we'll be doing is actually training all of our provider staff on motivational interviewing and developing clear case practice guidelines on how to use CARES, as well as how to support using data and documentation to improve outcomes. I like that. Some good stuff. You may have heard about the repair squad, and how many people have heard about the repair squad? Very good. So like I said, we have an infrastructure that has been neglected for many years. One of the things that Mayor de Blasio and Commissioner Taylor are committed to is ensuring that our shelters are safe. And so we have a task force that we put together that has been working with NYPD, Fire Department, buildings, Department of Health, and DHS that has actually been going out to shelters, not just giving violations, but actually fixing violations. And in the last 2 weeks, we have been able to resolve over 800 violations and health and safety issues in the shelters. And so, and that work is going to continue. De Blasio is very committed, the mayor is very committed to making sure that happens. Commissioner Bank talked about housing permanency. When we started over 2 years ago, there was not a rental subsidy program. Now we have a rental subsidy program. Over 4,000 families have moved into permanent housing. We have aftercare support through critical time intervention to support those families in the community, as well as home base that has an aftercare component to support our families. And last but not least is organizational excellence. We realize that we have to support this workforce. This workforce has been underfunded and unsupported, and so part of how DHS plans to move forward with that is through very intensive training of our workforce, as well as ensuring that our workers, when they're working with families and individuals, feel safe. And so there's coordination that's happening with the NYPD and others around safety and shelter. Next slide. So the need for supportive housing. So one of the things in preparation for this conference was to go back and look at what our need is in terms of how do we move forward and address these issues. So to date, we have identified about 7,000, close to 7,000 adults that have serious mental illness on our single side. And part of the way we support them is through mental health shelters, but we recognize that there's a need and what is the next step for them as they move into the community. There are over 16% of individuals on the single side that are either on SSI or SSD. About 35% of our adult family population is on SSI and SSD. And in our Families for Children Center, we see about 22% on SSI or SSD. Some good news, in 2014, 2,231 individuals were placed in supportive housing. And since January, we were able to place about 801 individuals in supportive housing. The next two slides really talk about our internal services around mental health needs. And so I'm not going to go through each one, but we really try to work very closely with our non-for-profit providers in recognizing what the needs are of our population. One of the gaps that we're looking at very closely is how do we assess individuals up front as they come to the front door. How do we receive information? We're working with the Department of Mental Health actually on developing an assessment tool. So as individuals and families come to the front door, we can get an assessment of what their needs actually are to be able to coordinate services better. So some of the services listed here are what's in shelter, but how do we advance that and how do we bring additional resources there? Next slide. Alrighty. Need for supportive housing. Let me put my glasses on.
Stop faking it.
There we go. I think this is my last slide, which really talks about one size doesn't fit all. And what I wanted to do with this slide was really just talk a little bit about when we think about supportive housing, we recognize that it needs to be unique to those persons' needs and having that flexibility in order to do that. And the array of supports that each supportive housing unit may have will be very different. And also as we think of permanency, permanency means different things to different families and different individuals. So NYCHA may be a permanent support, Section 8 in individual housing, supportive housing. Some may need preventive services in the community, CTI and mental health services, and others may not. And how do we target our services to meet those needs? Because we spent a lot of time this year looking at the individual and what the experiences of every individual as well as every family as they enter shelter, I wanted to leave you with today a story that I asked my staff to put together. And it's an individual that they've worked with for the last 15 years. We'll call her Mary today. So Mary was an individual that lived on the street for 15 years, since 2008. And the great outreach team knew Mary and knew Mary quite well, was able to engage her every day when they saw her and try to encourage her to come in to a stabilization bed. Mary was very strong in her opinions and attitudes and was not interested in entering shelter and not interested in coming into the stabilization beds, but was able to actually make a connection with those outreach workers. And one of the things she was very clear about was, if you find me housing, then I'll come in. That's all I want is housing. I don't want shelter. How can you find me housing? And the team for 15 years engaged Mary in this conversation. One of the things that was extremely interesting about Mary was that Mary met with her psychiatrist, Mary went to her appointments, filled out all the necessary applications, but Mary stayed on the street and said, find me housing. And so in January 2015, should I say the agency? I should. Mary interviewed at Capitol Hill. Is Capitol Hill here? Well, maybe not, but Capitol Hill.
Capitol Hall.
Capitol Hall. Take off the glasses. Capitol Hall. And when Mary interviewed at Capitol Hall, they were building. It was building. So Mary had to wait. She got accepted, and they were building. And then in January 2005, when the building opened, on February 17th, Mary moved into her studio apartment. And since moving in, we heard that Mary is doing extremely well. She has reconnected with her adult children and is still connected to that outreach team and letting them know how important it was for her to be in that supportive housing. So thank you, Capitol Hill.
Thank you, Lorraine. The Capitol Hall is actually guided Riverside's building. It was one of the first supportive housing projects that we had, and it went through this renovation, and so it sort of shows the powers of supportive housing. It was also, if you operate shelters as we do, it was very reassuring to hear what's going on at DHS, certainly in terms of helping to improve safety and services, the physical plant stuff, and then also workforce development. So that's really great. So just we have about 15 minutes, and as I said at the outset, I want to make sure that you have time for questions. So just give me some hands. How many people are going to ask questions? Okay. All right.
At the mic.
Go ahead. Yeah, if you could use the mic, that'd be great.
Good afternoon. Kisha, thank you for your wonderful, wonderful presentation. Regarding the 5,200 new units that are part of New York 4, can we expect that to be implemented? How much money has been set aside, and how many of those units will be specifically for New York City, since it is a state initiative?
Okay, I'll work a little bit backwards. So the ones for New York City specifically will be 3,923 units. A lot of that is contingent upon our agreement with New York City. So there is an assumed New York City share that was a part of the overall enacted budget. So we're working really diligently with New York City now. I was really hoping to have that locked up by this conference. Trust me, I was really trying to have some final numbers and some final, real information with that regard. But we're still working with them on that. So our overall goal, right, based on the calculations that we've run, would be the 5,200 with the 3,923 going specifically to New York City.
Okay.
And that includes, and part of this obviously is capital resources as well as the supportive housing, the supportive resources.
Okay, when can we expect this to be done?
So on the capital side, the RFPs have already hit the market, but on the operating side, so much of that is contingent upon the agreement with New York City. I think, as I mentioned, we're really trying to streamline, and I think one thing to note is we're assuming units come online about 2 years after, so that's why we felt comfortable putting out the capital side of the RFPs. It includes both congregate and scattered sites. But one of our goals, so that the providers aren't sort of running around, is for us to issue one RFP, and that interagency council really work closely together in the scoring of them. That goes both on the capital and the operating services side. So that's why it hasn't come out yet, but we are working extremely hard to get that out there.
Thank you very much.
All right, two for you, one for me. So go ahead, Karen.
Hi, I'm Karen Jorgensen. I'm the director of Valley Lodge, a DHS-funded shelter. I also just placed 7 people in Capitol Hall. Love it. My question is, in May of 2009, I testified at a hearing that the City Council had about changing the requirements for referrals to basically get rid of three-quarter houses. It is now 6 years later, and this problem is still happening. And I read about the city task force. I'm cynical because we knew about this 6 years ago. How are we going to make it different this time? And will you include in New York 4 provision for refugees from three-quarter houses as part of your quota of units?
Well, I think you make an excellent point that this is a very long-standing problem. And the administration has been here for a very small period of time for this long-standing problem. I can beat you on 2009 for when I was first in a three-quarters house. I think, as we've said in the excellent story that was written in other times, it met with 21 the coalition of groups representing residents on Tuesday, and so the trajectory of this is, I think on day one at HRA, we closed Center 71. We did a lot of things, and so it took us a few days into our year to begin to focus on this one, and we've been running some analytics which show locations at which people who are more than 10 or more unrelated adults are in residence, which is an indicator of three-quarters house where the only rent that's being paid is the $215 shelter allowance. And we have begun a series of efforts over the past months to address the business model, which involves, in some instances, Medicaid fraud and treatment of and unlawful treatment of residents. And so HRA has been cooperating with law enforcement over the period of time, these last months. And I think that it's a good sign that the mayor is providing additional impetus for our efforts. Inspections have begun. I think that I don't know if anyone is here from Samaritan Village, that we've worked very closely with Samaritan Village. Thank you very much, Samaritan Village. We've worked very closely with Samaritan Village and the court-appointed receiver and the narco freedom houses over the last several months to come up with a solution for the residents of narco freedom houses, which is a substantial portion of the numbers of people in three-quarters houses. And inspections have been proceeding this week and will continue of those particular locations, and then we'll move to others. So, I grant you your, is it fair to say, I grant you your cynicism, but I think that the actions that have been taken and will continue to be taken are very different from certainly what I saw when I was outside of government. And we're going to continue to work on this. But like so many things that I found at HRA when I first came, it took 20 years to get to the place we're at. They're not going to change overnight. But there is an urgency with how we're approaching the situation with clients and individuals that are in three-quarters houses. I think, as you know, the analytic that we run shows you where people are spending the state shelter allowance of $215, but there are people spending their SSI money there as well. And that was highlighted in the Times story as well. Excellent reporting done by Kip Barker. I think that you'll have to keep focusing on what we're doing. We're going to be very transparent. As I said, within just a very short time of the beginning of an enforcement task force, we've met with all the advocates and groups that are working with residents, and we said that we want to keep working with them, particularly to focus on buildings where there's an imminent need for immediate action, and where there are buildings through intervention that can be made more viable. I think the issue about whether or not what should happen with New York 4 housing is down the road. We're not waiting for all of those things to happen for the approach that we're taking now. And we're going to have to take that approach now to address real issues that residents have right now. So we'll keep working. It's not going to happen overnight, but it's a very different approach than we've seen in the past.
Thank you, Steve. I just want to, Kisha, if I could ask you a question just around the things with the silos. So not having the silos where you have these very hard numbers tied to specific categories would help fix a structural problem. But I'm also speculating, I guess it's dangerous to speculate in front of 200 people, but I'm speculating that also has something to do with being able to accommodate different communities around the state. And so, which raises the question of the role of localities in terms of determining who's going to be eligible for supportive housing.
Yeah, that's exactly right. We wanted to make sure that local areas had an opportunity to identify which populations were really relevant in their communities, so that they would be, in support of the development taking place for those communities. And that was also an important part of breaking down the silos. The issues in one community vary throughout the state. New York State is very diverse in a lot of different ways, between the southern tier and upstate Western New York, and then New York City, even within New York City itself, and the needs of the populations there. So that was definitely a part of it, us wanting to make sure we had the flexibility to address the needs of the different corners of the state.
So two for you now. Okay, here you go.
Hello. Hi, my name is Nadine Selby. I am a housing benefit specialist for Samaritan Village, Myrtle Avenue Men's Shelter in Brooklyn, and I'm a direct care worker, and I've been working in shelters for years, and I'm very passionate about what I do. And I work with a very vulnerable population, which are mentally ill adult men, and a lot of the population is dually diagnosed as MICA, or can be depending on the situation. So I've noticed this cycle in regards to housing. There's a program that is created with the funding, then maybe a couple years later the funding stops, and as a result you get recidivism and clients coming back to the shelter system, and it's a very vicious cycle. So what will be the oversight for these new programs. Because I work with individuals that are approved for the Link 4 and 5 subsidies. I work with people who are approved for New York supportive housing. So what type of oversight are we going to have? Because I remember years ago, Mayor Bloomberg said, oh, we're going to eradicate homelessness. And it's actually, it's been horrible. It's a bottleneck effect. And it was 60,000, now it's down to 56,000, which is great. But what about the oversight? What type of oversight are we going to have to ensure that the funds are there?
Okay.
Because we're, as providers, we don't want to see our clients become recidivists and come back into the shelter system. We're very passionate about what we do. So what type of change in oversight will happen so that way that does not happen again, or it's a significant decrease of that happening?
Okay. All right. Thank you.
Oh, and I got a softball question too.
Why don't you ask them both so we can decide which one to hit back?
Okay, it's about the criteria for the New York 4. The specific criteria for the New York 4.
How about I'll start on New York 4 and talk a little bit about, and talk a little bit about where we came up with the number and why that was important. Because I think that answers at least a part of your first question, and Steve wants to jump on the rest. So on New York 4, we're still ironing out on the populations. We're pretty close. I will say the severe and persistent mental illness groups, the populations that were included within New York 3 are still there. Survivors of domestic service. We are looking at military service folks, including who have a disabling condition, including those who were not granted honorable discharge, because there are populations where there's just very limited services for them. And looking at chronic homelessness, that was a part of New York 3, but also youth who are aging out of foster care, and youth who are, or older youth who are coming out of juvenile justice facilities, as well as wanting to make sure that we're covering for families. So I know that there were a lot of concerns about how many families were being covered within New York 3. And we're going to be using the Interagency Council as they review all the proposals that come in. To just touch a little bit on the first one, the New York initiatives are tied with operating subsidies. And one of the reasons why we crunched the numbers the way that we did is we want to make sure that there's not a fiscal cliff. And I think that speaks a little bit to your point on programs that start and then programs that end, and then all of a sudden, what are you going to do with those populations? So, I started in February, met with the network early, heard about the calls for, a much larger commitment on the supportive housing side for New York 4. But again, we really want to make sure that we're not running into any fiscal cliffs. So when we're doing our math for the long haul.
I mean, to build off of that, I'll also say, in my prior life as the lawyer who lost the Advantage case by a 4-3 vote in New York Court of Appeals. Right, so I lost that case by a 4-3 vote in the Court of Appeals. I'm acutely aware of the importance of continuing programs and not having the rug pulled from out underneath them. That's one reason why, in contrast to Advantage, we publish the rules for the programs in the city record. They're part of the rules and regulations of the City of New York. They exist. They can't be closed down and sort of on frankly, a whim, as the Advantage program ended. And it's very clear what the criteria are, in particular as to the clients that you've been dealing with, Link 4, clients that are receiving SSI, clients that are receiving other disability benefits. It makes it very clear, senior citizens, makes it very clear that that is ongoing assistance without a time limit, because that's reflective of what the needs are of senior citizens and people living in shelter receiving SSI, that you can't relocate them out of the shelter system and have a time-limited system, which is one of the huge flaws of Advantage, in addition to the fact that it was ended precipitously. So I think the experiences of past programs and the problems that have caused to clients have informed the development of the current programs, and we've gone a step further, which is making it very transparent what the rules are and what the contours are. So I think the oversight is exactly what the City Administrative Procedure Act intended for the oversight to be, which is the oversight is known to the agencies but known to the public.
Right. And just to add, the need for aftercare support, and what does that look like? And so I think DHS, in terms of not just giving a family a subsidy and sending them on their way, how do we connect them back to their communities? And how do we have communities adopt families and individuals that are returning to communities, and what does that look like? And how do we strengthen that work across the board to keep people in their homes?
So hold on a second. So this has to, we're supposed to go to 3:15. It's 3:15. A number of people have, been waving at me, because I know there's questions, which suggests this was a very good panel. And I know beforehand people were talking to me that they wanted to talk, get the panelists to talk about supportive housing for families, and there's a lot of stuff that people want. So let me suggest this. I think folks might hang around just a little bit to be able to answer questions individually as opposed to keep everybody. So I want to thank the panelists. I want to thank you. I want to thank Edlene Jacquot and McLean Bearhop, sorry I was blanking on that, for helping to put this together. Okay, that's it. So feel free to come back up here.